discussion here, which would be great. My name is Shaden. I'm a doctor of physical therapy, and this is my partner and friend, Jennifer. We are going to be talking today about how to get your body back after baby. So Jennifer and I work, I'm the founder at University's Physical Therapy and Wellness Center. We specialize in orthopedic physical therapy, as well as pelvic physical therapy and women's health. So I started the practice out of a need for just educating the community on what's normal and, what we can expect after having children. We treat people from really not just people who've just had children, but also people who have had children, maybe even up to 10 years ago or even longer, who never really fully resolved some of those issues, and they turned into sort of chronic issues. And Jennifer will get into some cases that we've had that, that was the case. And Jennifer is a physical therapist here, and she specializes again in women's health and orthopedics. So as a practice, our aim is to empower and energize our patients to get into a healthy, active lifestyle, by getting them back to doing what they love. Really, as a practice, what we're doing is we're trying to raise the standard in healthcare, really just that we feel that, cookie cutter approaches really just aren't enough, and that a real individualized plan for someone that involves deep look at the root cause of the problem. So, people will come to us with maybe back problem, right, that they've had for years and years, and it'll turn out to be that there's some sort of imbalance in the hip muscles or some sort of imbalance in the sacrum that really was never picked up on. So we really pride ourselves on finding that root cause of a person's problem. So we really look up and down the chain. So that's sort of about, the practice and the way we do things. I would like to hand it over to Jennifer. Jennifer has been just instrumental as one of our lead physical therapists here, practicing pelvic floor PT. It's really her passion. She's a mom and she gets it, and I'm a mom, so we get it, and we love to help women, just get back to living their best life. So this is Jen.
Okay. So I just want to kind of highlight what I hope and what I know you will get out of this presentation. So one of the things that's most important is just really understanding what our body is going through, or what a woman's body, what your own body is going through. So common body changes that are supposed to happen that occur during pregnancy. But then, of course, what are some of those potential dysfunctions, diagnoses that can happen postpartum, that can happen while you're still pregnant? And what of those things can we avoid versus what's sort of inevitable to happen, but that we can help with? Once you've had your baby, then we want to know, well, what's normal, what's abnormal, and again, what is something that we can help with? Maybe even some of the normal stuff is stuff that we can help with to prevent from becoming something that leads to pain or leads to greater dysfunction. Then, along with some of those things, then we want to point out what are some of the misconceptions that people can make after having their baby, and then how can we avoid them? I think there's a lot of information out there that can either really help us or really make us a little scared and a little uneasy when we try to think of what our body is going to go through and how it can recover. And so my hope is that I can bring a little bit of awareness to that and calm any of those fears. Then, of course, we want to go through, well, what can you do that's safe and effective in terms of exercise, movement, things that you can begin doing to begin your postpartum healing journey. And then in those things, if you are recognizing that something is not feeling good, then we know that those are warning signs and those are things to look out for that you can make a difference with. Then little tidbit and things that I've experienced myself, but also things that we know mechanically that we can help our body understand is we have this beautiful baby now. Now, how do we move and work around with our baby without feeling like we're hurting ourselves? So little hints that I can give on how to properly lift and handle your baby in a variety of different scenarios that we can't get around as parents. but that we want to identify if we can do a little bit better so we remove that threat of pain. And then, you know, all of these things are going to be tools that I can give you to help identify and signal that something might need some help. It's a relatively new and up and coming theory, and something that I feel very strongly about, that women should have some kind of improved postpartum care after birth. They should be coming to see someone like myself or a pelvic floor physical therapist near them to be able to see what's going on in your body and how you can really make adjustments and how you can improve. And if you're listening through this presentation and you feel like some of the things I'm discussing sound like you, don't panic. Know that you are one among many other women that are dealing with some of these same symptoms, who also don't know that it might be something that needs to be addressed. But the good thing is, if you're noticing these things and you feel like that sounds like you can come and see us, you can come and see me, and we can have what we call a discovery visit at our clinic that would provide a little bit more insight to what might be going on. Okay, so these are just some initial questions. And again, these might be some things that might get you thinking and triggering, hey, this sounds like me. So has it been months since you had your baby and you're still feeling like you're having trouble moving, feeling like yourself, recovering? Do you happen to notice any kind of symptoms such as leakage, back pain, a strong urge to urinate frequently, pain with bowel movements, pain with intercourse, hip pain, anything that feels like could be a problem? Have you voiced any of these concerns to any of your medical professionals, your OBGYN, your GP? And have you felt like maybe these symptoms haven't necessarily been validated or heard? I'm hearing you, and I'm here to tell you why they're happening. So I think it's important to just kind of look at some of these numbers, right? And again, this just relates to what I had just said, is you are not alone if these are things that you're experiencing. The numbers speak for themselves, and the percentage of women that are complaining of a variety of the symptoms that I'll have some of my patients come in complaining about. Low back pain, pain during pregnancy that continues after childbirth, heaviness, pressure, pain in the pelvic region for any kind of pelvic functions, from anything from urination to defecation, which is bowel movements. Any pelvic floor conditions that you might have been told about that you're not really understanding what they are and how they're impacting you. Some kind of abdominal separation, which clinically we call diastasis recti, that tends to happen in most 100% of women during some level of pregnancy, but the level of that sticks around is what's important to note. So as you read through, again, hopefully this is just a reiteration that this is not something uncommon, but it is something that can be addressed. So this is just a really nice image that highlights all the major systemic, meaning full body changes that your body is going through as you continue on through your pregnancy journey. You know, these are all different body systems that have a huge impact on how we function when we are not pregnant. And it's only natural to think that these things will have to change to accommodate our body, because we are growing life. And it's not just us that our body is worried about supporting anymore, it is our baby. So all of these things have to change. They are inevitable, but they can come with some lasting issues that we want to address if they are long lasting. And so now this is a little bit more mechanically or orthopedically, right? Meaning our bones, our ligaments, our muscles and tendons. What is changing, and why could this lead to so many different what are called musculoskeletal issues? As our baby grows and as our body begins to change, our rib cage will elevate, our diaphragm, which is our breathing muscle, will elevate to allow and accommodate the growing uterus for the baby to continue to grow. That changes our spinal alignment, our pelvic alignment, and all of these things are necessary, but we want to understand that they're natural to happen, but we also want to take a peek at what they are so that we know if they are lasting for a lot longer after we are done giving birth, that we want to make sure that we're knowing that they are not coming with pain. So anything from, and you can see right here, you know, Shaden mentioned in the beginning, when we look at the entire body, this picture is proof why. Because just because our baby is growing in the center of our body does not mean that the whole rest of what's called our kinetic chain from head to toe is not also changing, all the way down to your toes and ankles, all the way up to your head and neck. And so these are just some of the things that I would look at in a postural assessment, in strength assessment, movement assessment. These are just some of the pieces that I would look at if we were one-on-one together in a session. And this is just a nice little summary of what I just said. So what's happened to our bodies? Organs are squished and move around. Our ribs spread. There's downward pressure, on our pelvic floor to accommodate for all of this central growth. Our maximal stretching of our abdominal muscles, and that causes some overcompensation in back muscles. If something is pushing forward, the back is going to respond. Again, from a systemic level, right, our hormones change drastically. And again, that's essential. But what that does come with is ligament laxity. Our ligaments begin to have a little bit more stretch and our body begins to move a little bit more. That changes the level that our muscles have to react. And if our muscles didn't have that strength to begin with, it can be really challenging for our muscles to now know what to do. Necessary weight gain. No worries there, but it does affect our body's center of gravity and therefore will contribute to a lot of the postural changes that we see. And then, of course, our bodies are changing. So it's definitely something we want to look at to see how is our sleep. If you're here, you've maybe been pregnant before and you know that sleep can get disturbed. And sometimes that continues after birth. And knowing that we get most of our recovery during our sleep, it's a really important topic to discuss as we look forward towards healing our bodies. So just as a highlight, these are some common diagnoses that I've seen and treated with some of our patients. A lot of these may seem really, make sense, right? I've just talked about some of the areas of the body that are really going to change. So I will see lower back pain, sacroiliac joint pain, pelvic floor dysfunction, which is huge. What I call diastasis recti before, which I'll explain in a little bit. Pubic symphysis pain, where each side of our pelvis comes to connect kind of right in the front of the pubic area, our pubic bones. Thoracic and cervical spine pain, mid-back to neck pain, hip pain. And then, even from there, right, wrist pain, lifting our kids up, shoulder pain, being able to push our children on the swing. That symptom is what led a patient to me just very recently. And the shoulder pain was the main complaint. But as we started looking at her body and as we started looking at really what had changed after having her 2 children, and that is after 2 children, right? So many years, not just immediately postpartum. We started looking at that and we realized that there were a number of different postural changes and body changes that really needed to be addressed. And so that's just one example, and I'm sure I'll come up with more as we keep on talking. So I feel it important that, we kind of have a little understanding of what some of these musculoskeletal areas are to help make it make sense a little bit more. So the pelvic floor is a group of muscles that sort of sits underneath the pelvis. It's kind of sits like a trampoline, like a sling, right? And the functions of it are primarily for sexual function, so intercourse, sphincteric closure, meaning closure around the urethra, closure around the vaginal opening, and closure around the anal opening for proper passage of bowel movements, proper urination, and support. The pelvic floor muscles support our pelvic organs, our abdominal organs, and are very, very responsive to 2 major things that I've seen in my practice: very responsive to pressure and very responsive to stress. And those are 2 things that, one, pressure being our body is really trying to manage that pressure regulation now that we don't have our baby in our belly, and trying to kind of normalize, come back to normal and come back to like what's called a homeostasis, where your body feels supported. And then with that support is really a very important thing. And it's, a little fun fact that our pelvic floor muscles stretch to about 250% of their resting length during childbirth, and really do have full recovery between 4 to 6 months postpartum. So if you are going to your OB, I had a patient who was going to her OB, and after almost 6 months was having a lot of difficulty with what's called stress urinary incontinence, meaning that every time she lifted her baby, or she was carrying her baby in her baby carrier and walking up the stairs, she was leaking urine. And we know that we want to give our body that time to heal, but that also doesn't mean that we can't get ahead of some of those symptoms and really have a hand in helping the body find its healing. And then the next most important piece to look at is our abdominals. So that term before that I used, diastasis recti, is just clinically known as a separation of the paired rectus abdominis muscles along a piece of fascial tissue called the linea alba, which connects the two together. Again, some degree of natural stretching is normal during pregnancy. Most, if not all, women will have a semblance of stretching in this area. What we want to pay attention to is how long is this staying, and does the body need help healing those muscles? Poor exercise performance, potentially going back into exercise too quickly before our body has healed, can lead to or precipitate low back pain, pelvic floor dysfunction, and can exacerbate some of that diastasis width that we see. And so below are some pictures of some different areas. I have a patient right now as well who I'm treating for diastasis recti. And again, she is not immediately, she's had multiple pregnancies. And so that is a little bit of a risk factor when it comes to that. But it does not mean that there cannot be healing after that period of time. So we look up and down those abdominal muscles to really have an idea of what we're dealing with and what level of input and re-education that these muscles need. And again, fun fact, the abdominals will stretch to about 115% of their normal resting length by 38 weeks pregnancy. So this is just another thing to be aware of, and sort of maybe, again, one of those things that you might be looking down now and looking at your belly and kind of seeing if you see any of that separation. And if you're not sure, or you may be having some low back pain, maybe there are some pelvic floor dysfunctions in the way, such as some incontinence or urgency or things of that nature, that might be something that we might want to chat more about together in a discovery visit. And so I mentioned pressure before, right? So one of the first things, and I will, with a high level of certainty, say that I do this in a large percentage of my patients, is I immediately look at breathing postpartum and how your body is able to re-regulate, so to speak, that pressure management. Breathing is really, really important. Thank goodness we don't usually have to think about it. It's one of those beautiful autonomic things that happens in our body. But there is a level of training that we can do to improve the function of our diaphragm muscle and improve the ability for pressure to be well managed and regulated in our body. Remember, when we are pregnant, our rib cage is moving upward, the diaphragm is being pushed upward, organs are being pushed upward, and it really can inhibit how the diaphragm is able to function afterwards. And sometimes the body is going to need a little bit of help re-educating that. So in general, when we inhale, we want our ribs to expand, and think of your abdomen as kind of like a barrel, right? So rib cage on either side, and we really want that rib cage to expand to all parts, 360 expansion, forward, sideways, and backward into the back space of our ribs. As a result of that, our belly will rise, the diaphragm muscle starts to descend downward to allow for air to be taken in. We want that to be slow, gradual, nice and relaxed, and the pelvic floor will reflexively then descend downward and drop downward, lengthen to allow for that pressure to improve. As we exhale, I like to tell my patients to be really active with this. So inhaling through the nose, really having that nice loud, auditory, active exhale. We want to feel the ribs drop down, the diaphragm rises back up instinctually as the muscle relaxes. Our lower transverse abdominis muscle can begin to engage. That's how I try to train some patients to really gain back that education of that abdominal muscle. And the pelvic floor rises back up to a resting state. And so we think of any exercise, right? A squat, and take it away from exercise, but picking up your child from the ground or picking up your child from standing in the crib, carrying them around and lowering them down. Any movement like that, we want to be a little bit more mindful in that postpartum stage of how we're breathing and that we're not holding our breath against movement and we're using breath to inform our movement. And that again is a piece of what can help our bodies heal. So you've heard me maybe mention a couple of these phrases already, but let's just put it out there, right? What might not be normal? And I like to say as a rule of thumb, this is typically following about 6 weeks to 8 weeks postpartum. And the beauty of humans, right, is that we're all different from one another. So this might fluctuate a little bit based on your body and your healing time and, you know, your prior level of activity before pregnancy. But in general, these are things that might start to send yellow and red flags to our brain that we might want to take a closer look at. So that stress urinary incontinence, where we're leaking with activity, coughing, sneezing, lifting our children, running with our children. Increased urinary frequency or urgency, meaning that you need to go, you know, urgent. We want to see that we're at least able to go, you know, that there's greater than every 2 hours between any urinary voiding. Pain with sexual intercourse, difficulty passing a bowel movement, and that might be in the way of constipation, that might be in the way of pain with passing a bowel movement. Nerve type pain, which would be, you know, sciatica is kind of that key symptom that everybody knows. And any kind of cervical, meaning neck radiculopathy meaning pain kind of traveling away from that source. That might be something that we might recognize when we're bending to pick up our kids or bending to, you know, whatever, we return to work and we're sitting at our computer desk maybe, and we're noticing that pain coming down our arm. Feeling of pelvic pain or heaviness, pain with exercise that cannot be alleviated with modifications. And I really want to stress that because exercise should be something that we are not having pain with. It should be something that our body is perceiving not as a threat, but as an asset to helping us improve. So if you're having pain with an exercise, that does not just mean that you want to power through it. That doesn't mean no pain, no gain. I actually, quite frankly, hate that phrase because pain sometimes is telling us something. And it's important to figure out what that something is. And then excessive bulging of the abdomen, which could be related to that diastasis recti. So a postpartum reality that I enjoy really pointing out to a lot of my patients, we may not be able to truly get our pre-baby body back. And you know what? That's okay, right? Our body went through a big change, and it brought in life, and it made all of these changes to be able to do that. And it's okay to realize that our body may now be different. And I like to help my patients shift that focus to say, well, let's bring our body back to a healthy state. Let's feel powerful. Let's feel safe. Number one, right? That's the most important thing, and strong to take on this motherhood journey, and also be educated, right? Educated on what we might want to know is normal versus something we want to address. So why do we exercise postpartum, right? I'm mentioning that we want to be safe about our exercise, and we want to make sure that we're recognizing yellow, red flags, warning signs that something might not be right. But all that being said, exercise is very beneficial for our postpartum bodies. We just went through all of the changes that our bodies just spent 9, really 10 months going through, and changing, adapting. It's only sensible to think that the body would need that time, and maybe then some, to recover from those changes. And I tell people that whether I'm seeing patients that have been pregnant or not, right? Anytime we're dealing with a problem that has become a little bit more chronic, and chronic, we consider really anything greater than a 3-month time span. We need to recognize that our body spent time getting to that state, and our body's just not going to immediately respond. That's also okay. That's also a nervous system protection mechanism our body has. But if we slowly help the body adapt there, we can help it recover. We just need to be patient with our body. And all the while we exercise, we are improving our mental health. As a mother myself who suffered from lots of postpartum anxiety, exercise was a missing piece that I didn't realize for so long. And I do this for a living, right? So we're all not alone. As much as we know, sometimes we need those reminders. Exercise can really help to give that mental health improvement and really help you feel like you're doing something for you, right? That you're doing something for you to make you in a better place to help care for your baby. Increasing blood flow to promote tissue healing, right? These tissues do need to heal, even though we didn't injure them, they changed because of pregnancy. But we want to get that good, rich blood flow in there, so we are informing the tissue of what we want it to do to heal well. Reconnecting with your body after labor. Labor is a chore for the most part. And our body just really goes into a big flight or fight mode, if you've ever heard that term before, when we're giving birth. So to really reconnect with our body and really identify where it is that we need some extra guidance is really important, and exercise can help you do that. And then, of course, postural re-education to support your baby's needs without sacrificing your body, right? And so that kind of will bring us to that last little bit where I'll give everybody some tips about some lifting, handling techniques. And posture truly really is everything, and form is really everything when we're exercising, so that we're really making sure that we're targeting the muscles we want to and not encouraging any overcompensation or overactivation of muscles that we don't really need to be a part of that exercise. Okay, so this will be a little fun thing that, we won't take too long going through, but 7 of the most common misconceptions people may have after having children, how to recognize them, avoid, and power through them. So the first one is, I'm not in pain. I'm ready to jump back into my normal routine, right? Pain is not always trustworthy. The absence of pain doesn't necessarily mean that you are ready. And I mentioned that before, right? We try to use pain as a guide, but if you're feeling that a muscle just doesn't feel like it's contracting, you're trying to help improve your abdominal strength and it's just not working, there might be a reason, there might be an inhibition that your body is going through. There might need to be some stretching, some fascial release, some really specific pinpointed cueing as to how to get that going. Pain does not necessarily mean that you're going through something, but the compensations that your body may be beginning to make, oftentimes I find, is what will lead people into having pain. So I'll bring back my patient, with her shoulder pain, as we've looked through her treatment and we have looked at posture, we've looked at abdominal strength, we've looked at low back symptoms, we've looked at the pelvic alignment. And some of those things, they didn't just happen, right? They've been there, and her main pain is now shoulder pain. My assumption, my hypothesis, right, is that a lot of those compensations, a lot of those postural deviations may have led to some difficulty with handling the shoulder, and really strained the shoulder. If there wasn't good pressure management, if those abdominals weren't kicking in, that shoulder, when she lifts her sweet baby, needs to work harder, but it really doesn't have to if everything else is all aligning and working well. So the key takeaway here to remind yourself of is that given the opportunity, our body can heal itself. And we don't need to feel pain to begin healing our body. Don't wait for pain to let you know that something's not right. So second one, I haven't peed my pants yet, so that means that I am fine. Again, remember, compensation is the body's go-to mechanism to heal itself. We do not want these compensations to stick around, okay? And so some of these compensations may be helping our urinary function for now, right? We might be, really doing lots of Kegels because that's what Google said, right? Muscles of the pelvic floor are restoring to their pre-birth length. Maybe there was some tearing, maybe there was an episiotomy, maybe there's some dysfunction there that those particular muscles are not able to really overpower, but there is still healing, right? So we don't know if that symptom will be there. It can take days, months, years for incontinence to present. It doesn't have to happen immediately postpartum, like my previous patient that I had talked about earlier. But you should, right, be a little bit aware of the fact that sometimes these symptoms can take a little bit longer to develop. But we know, as we just discussed, what that pelvic floor goes through while we are pregnant and while we are giving birth. So why not think to yourself that I deserve to check out what was going on in my pelvic floor all this time and see if there is something that I want to get ahead of. Did these muscles tighten up while they were healing? Is that why I'm having a little bit of pain with intercourse, but my doctor told me that it was normal, so I'm going to give it a little bit more? That might not be normal. That might be you, right? Those muscles reflexively tighten because that sometimes is what happens when the body's trying to compensate and heal. And we might not know that that's going to cause a problem until it is a problem. But because we do know, why not check it out? So I want my body back so badly that I'll immediately begin an intense exercise program to speed up the process. Remember what I said before, right? Jumping right back into exercise in a graded fashion is important, but going too quickly before we really know what our body is capable of may not be the right thing, okay? Before beginning a program before your body is ready will not result in positive changes most of the time, right? We want to know that our body is in a place where we can exercise well. If we go too quickly, if we start crunching on those abdominals, if we start really squatting and we don't know what the state of our pelvic floor is, we could be predisposed to some really undesirable symptoms and diagnoses that we could have avoided, and we maybe could have avoided, or maybe could have been a little bit more aware of. Allowing your body to be nurtured and heal and address some of those symptoms will allow you to exercise with greater confidence and will just support your new, amazing body. So I'll just do crunches to get rid of my tummy. So I just mentioned that before a little bit, right? Here's the secret. Most crunches are performed wrong. And so, if you don't know, you wouldn't know, right? So with crunches, especially if we're having a situation where we want to really make sure those muscles are healed, we could be using more force through our lower back. We could be clenching in that pelvic floor to kind of really support any pressure that's being pushed downward. If we're not breathing appropriately and really not engaging that very lower transverse abdominis muscle that is the support of the spine, we can have it lead to something like diastasis recti. That poor management can lead us to pelvic organ prolapse. If those pelvic floor muscles really can't support, that could be one of those options. And so I think it's important that exercise is on a continuum. It's graded. The high level stuff is not for everybody yet, and we want to meet our body where it is. So crunches particularly is quite an advanced exercise and should be progressed to appropriately. And that is something that, a pelvic floor physical therapist, myself, can help make sure that you are ready for, so there are no surprises along the way as you continue exercising. I will wait until I'm done having kids to address my problems down there. Unfortunately, the body does not work like that. That would be great, right? The reality is that the pelvic floor does not halt dysfunction between pregnancies, right? If we're gonna have more children, or even just having one child, right? Our body is still going through its day-to-day activities. Pressure is still being regulated. or trying to be regulated. And if you're having some discomfort before choosing to have another child, you really do want to consider discussing those symptoms with someone like myself, because there may be something that we can get ahead of before your body would go through a whole other set of changes with an additional pregnancy. There is a lot that can be done between pregnancies to ensure that your body is stronger going into that next pregnancy. Really, the way we think about it is the more things that happen repetitively to our body, the more tissue trauma we can go through, the more compensations our body will end up having. And then that can lead us to more of a chronic pain situation, which is certainly what we don't want as we're welcoming all of these beautiful babies into our world. The body heals because we allow it to. And if we give our body that little help healing, that will make us extremely more resilient, set our bodies up for greater success as we continue on with whatever that is. It doesn't have to be more pregnancies or births. It could be returning to work. It could be just being available in a healthy, active body for our little one that we have, continuing on throughout our life and growing with grace. Okay. I will only look for help if I need it. So again, just because there's no pain or you've received your 6-week clearance from your OBGYN does not mean that your body has fully gone through its healing process from the structural, emotional, and physical changes that our bodies have gone through. I've mentioned already the muscles of the pelvic floor are often overlooked. A number of patients that I've had, one of their largest reports back to me is that it's something that they've discussed with their doctor over and over again. And the thought is that, we just need to give the pelvic floor more time to heal. But the pelvic floor muscles are muscles just like any other muscle in the body, just because they might not be talked about as often. Although if you are on social media, it's a big buzz now, which I love, which is great, giving people lots of education about it. But it's often not as looked at as the structural situation of what has gone on in the vaginal area after childbirth, or in the abdomen area after a C-section, which I want to add, just because you've had a C-section does not make you void of having any of these issues. The body still went through this pregnancy change. And it doesn't matter how you gave birth. Some of these things can be results, either way. But you might not feel like some of these symptoms that you're feeling are worthy maybe of even mentioning to the doctor, and not knowing that they may be situations that do need help. In general, most women do feel pretty good by 6 weeks, but sometimes we don't. And even if we do, and there's small little peaks of some of these things, why not give our bodies the best chance to recover? And as I mentioned, I feel it should be recommended for all women, and the support should be there for all women to be able to seek an evaluation from a pelvic floor PT postpartum, maybe even during pregnancy if some of those symptoms are presenting at the later stages of pregnancy. But it's just something that I feel really strongly should be really staple. And we should be given more education about it as we leave the hospital and as we continue on with our follow-up appointments with our doctors. This one's funny, my favorite. My grandma had 7 kids and never had to go through this, so why should I? The real answer is you don't have to, right? This is all just really great information that I hope you guys are absorbing, but we should want to, right? We should want to give our body the best chance to heal. To older generations, I find, in looking at research and talking to some of my women who I am seeing in an older age now for pelvic floor related symptoms, one of the largest things I hear is that, you don't talk about it, right? You don't talk about the vagina, you don't talk about the vulva, you don't talk about any of those body parts, you kind of just keep those things to yourself. They were thought to be too vulgar, or, that wasn't kind of the communication that they wanted to have with their doctors. And so, nowadays it's sort of switched a little bit, I think, where people view leaking or having, difficulty with intercourse, sexual dysfunction, it becomes a little bit more joking, in a joking sense, right? We pass jokes about it and we're like, oh, I had babies, I had kids, it's normal for it to happen. Or if you're a little older, I've passed a certain age, I've had kids, I have all the risk factors, it's just normal for me at this point to have it. It's really not normal at any age with any risk factor to be leaking urine or leaking stool or having any of these issues, right? Are we more susceptible as we age? Potentially, but it's not necessarily normal to be experiencing this stuff. And the great thing about medicine and science is that as time has gone on, we've evolved. The pelvic floor field as a whole has become well more researched and well more supported by a variety of practitioners. And we're still working on that, but we've grown into a highly sought after phenomenon. And it's, kind of that thought where now that we know what we know, we think about what you can do for you and potentially what your grandma would have wanted to be able to do for herself, but didn't know how. And we have that ability now, which is awesome. So in this format, it'll be a little challenging to really describe some of these exercises, but I do have pictures and stuff. And, what can you begin to do at home to help heal your body that I feel is relatively safe, and can give you a little bit of information about what might be something you want to look deeper into. And so, this is just a list and we'll go through. Before that, I'd like to point out that, if you're listening to this lecture so far and you're lifting your shirt, you're feeling your belly and you're wondering, is that me? I teach patients sometimes to do a little bit of a self-assessment, and, this is all over the internet as well, but why not give you some expertise on how to look at this? So you can do a little self-assessment for diastasis recti. If you lie on your back in a very relaxed position, you can place 2 fingers right at your belly button. So if you go at your belly button, just go slightly above. You'll kind of sit your fingers there and then slowly lift your head up so the shoulders hover up off the ground. What you'll assess for is a gap or a separation. You'll feel that your fingers can almost kind of sink through a little bit. In the clinic, I would look at that all up and down. I would look at it from the top of the sternum all the way down to right above the pubic bone. You can do that yourself too. And clinically, I know that it's not just one place that the diastasis might be. It might be more pronounced in another area. And what I look at is greater than 2-finger width. So, of a separation this way, right? Depth is also important, but that could suggest a diastasis. And if you're looking at that on your own, it might be something that you want to give us a call and set up a discovery visit with me for. Another quick test that you can do is something called an active straight leg raise test that I routinely do on patients. And this is just looking at the ability for your abdominals to support movement through your lower body. Our pelvis is the area of the body that takes on more multi-directional forces than any other area in the body. So if the pelvis and the abdominals can't sustain stability in the pelvis, you'll recognize that from this test. So you'll lie flat on your back with your leg straight out. With a straight knee, you're going to lift one leg up off the floor. And then you want to tune into any movement that might be happening at the pelvis on your opposite side. So if you go to lift up your right leg and your left hip starts to lift or your left hip starts to dip down, that movement on the opposite side could suggest that there might be some poor pelvic control, poor abdominal control. You might be holding your breath, and it will for sure trigger that there might be some decreased core strength or a decreased ability to really recognize how to properly engage those muscles. Another little quick assessment is something called a Faber assessment, just named for the directions that we're moving the hip in. So you're going to lie flat on your back. You're going to cross one leg over. So your hip is sort of flexed for the F, abducted, which means pulled away from your body, which is the AB in Faber, and then rotated outward, which is known as external rotation, ER, which is the ER in that word. You're going to provide a slight push on the outside, on the inside of your knee, or just allow the leg to sort of fall out to the side. your attempt is going to be to keep the opposite side of the pelvis on the floor. If you notice that the pelvis is lifting, or you have some pain or a little bit of a tightness in that hip that you're pushing down, that could suggest that there might be something going on in that sacroiliac joint. There might be other muscular imbalances that might be worthwhile looking into before you start really exercising your hip or your low back. And then I've mentioned this a little bit. One of my favorite things is, can I just do Kegels? Can I just do those Kegel muscles to strengthen my pelvic floor? Listen, you could, right? But the deepest part of this that I like to get across to my patients is only if they're done correctly and for the correct reason. Again, there might not be knowledge of what the state of your pelvic floor is. Is it really tight after giving birth? Is it really lengthened and really lost its resting tone? So now it has a lower tone, so you really can't gain that strengthening. In doing Kegels, are you really contracting your pelvic floor? Are you contracting your glute or your butt muscles? Are you engaging your abdominals overly instead of really getting at that pelvic floor contraction? The correct muscles are everything in any exercise. And we don't want to overuse them either, right? So can you identify if the Kegel is right for you? Typically speaking, if the pelvic floor is having a difficulty relaxing, you may be experiencing something like painful intercourse, vaginal burning, chronic constipation, difficulty starting a stream of urine, pain in the pelvic region. Those might be key symptoms that suggest that the pelvic floor might not be in a state where it's ready to strengthen. It might need relaxation, and therefore you really should not just do Kegels. So that is an important piece of education that I always push across to patients. If you've done them throughout your pregnancy, if you've done them after pregnancy, don't worry. You didn't do anything wrong. But if they're not helping, right, or they might be contributing to your symptoms, that might be a reason to give me a call. Okay, so tips for safely handling your little one. Actually, I'm sorry, let me circle back here a little bit. So we'll go back to the exercises here. Okay, so diaphragmatic breathing is really just about what we did and what I talked through in the beginning and on that breathing slide there. So really ensuring that we're getting appropriate rib cage mobility, that we're really allowing the belly to rise. We're not engaging or tightening in the chest muscles, you overusing what are called accessory muscles to breathing that will function, but shouldn't be the main drivers behind behind breathing in general. Transverse abdominis activation. So your transverse abdominis, if you were to kind of stick your fingers in the front of your pant line and kind of feel right where your hip bones are, you go inward a little bit, you're right on that where I help train people to kind of think of feeling their transverse abdominis muscle. It is a big broad muscle though that wraps all the way around and has fascial connections to the spine. And so it is thought of as our body's corset, our body's girdle, right? Kind of when that contraction happens, we get some good spinal stability. So really learning appropriate cues on how to properly activate that transverse abdominis can be really important. The couple of things that I like to tell my patients is, if you imagine that you're from the top of your pubic bone all the way through to your navel, like you're zipping up a zipper. As you're slowly engaging and pulling those muscles upward, imagine that closure through the front of your abdomen, and as if you were zipping up a jacket. Another cue that works for a lot of my patients is imagining what you might do if you were trying to fit into a pair of jeans that was a little too snug. So things like that, and really thinking about that. And if you're recognizing that the front of your abdomen is really contracting, or your glutes are squeezing, or you're really having a hard time isolating those muscles, it would be something that I suggest coming in and being educated about, because again, exercises are only appropriate if they're done correctly, and if we're really speaking to those muscles with good instruction on how to help. Now, pelvic floor coordination, notice I didn't say strengthening, right? Because we want to coordinate what our pelvic floor is supposed to do with pressure management. So that kind of circles back into that diaphragmatic breathing, right? So as we inhale, the pelvic floor will descend down, it will lengthen. And as we exhale, our pelvic floor will rise back up to its resting place. So just really thinking about a trampoline, right? And that's the best way to really describe the pelvic floor. Thinking about a trampoline, as you inhale, that trampoline, you know, what's in the center gets heavier down on the pelvic floor. Imagine also a balloon, right? Filling up a balloon in the center of your body. You inhale, you're inflating that balloon. Pelvic floor has got to move down to be able to accommodate for that balloon to inflate. And then as you take that air out, as you exhale, that pelvic floor is going to rise back up now that there's more space. And that can really help to promote good pelvic floor muscle relaxation, help to instinctively release some of the tension that might be happening in the pelvic floor. And diaphragmatic breathing in general, in addition to coordinating it with that pelvic floor movement, is known to really activate what's called our parasympathetic system, which rest and digest, right? It takes us out of that state of tension. It takes us out of that state of fight or flight and really promotes good body relaxation, which is overall helpful. And then spinal mobility and hip flexor stretching, right? One of the biggest areas of the body that I really see impacted, especially thinking of the pregnant belly kind of moving outward as the uterus is growing. We get this really kind of swayed back position, and that causes the front of our hip muscles to tighten. And now when we're bending repetitively and flexing through the hip to try to really bend down and pick up our babies or do housework, or we're back to work and we might be sitting, or we're back to work and we might be moving around, but we still are walking around in this posture, really targeting those hip flexors can be a good source of restoring some pelvic position, and reducing some pain initially. And, you know, there are a variety of ways to do this. You can kind of half kneel where you're kind of kneeling on one foot and the other foot's up in front of you and leaning forward. So that back hip is getting a good stretch. But again, if you're feeling like, you know, yeah, that really kind of kills every time I get up to stand, I feel that stretch in the front of my hip. And I really want to make sure that it's not pain, or I want to make sure that I'm really stretching appropriately. That could be a reason to consult someone like myself. And then spinal mobility, something like if you're familiar with yoga, like a cat camel or a child's pose, you know, really like laying on your back and letting the legs rotate from side to side. Something like what's called an open book, where you're laying on one side and really opening up the upper thoracic spine. Neck mobility, all things like that can be really, really beneficial as the spine was really the center of where our gravity was really being offset all this time. So I'm going to jump back down to here. So tips for safely handling your little one. I'm sure maybe you've gathered a lot of some of these things from what I've already said. But we want to focus on holding your baby within the front of your body rather than off to one side. It's important to frequently switch sides while you're holding your little one. We don't want to compensate and just get one side of the body used to things like feeding or multitasking. I was guilty of it. I'm right-handed, so I'd always hold my little guy in my left hand so I could have my right hand free. And I was able to really notice a lot of those changes, and really had to remind myself to be a little bit ambidextrous in that scenario. We want to maintain optimal sitting posture. So no matter what way you're feeding your baby, bottle or breastfed, using a boppy pillow, using some kind of supportive pillows to help your baby lay so that stress isn't so much on your own arm. Placing your feet flat on the floor, supporting yourself with pillows, wherever that might be, behind your back, behind your head, and really having that be within a comfortable chair. Not kind of slumped down in on the couch, not kind of, you know, laying back in bed, even though in the middle of the night, that's probably what we would go to as the easiest thing, but really being mindful of how we're setting our body up for some of those things can really have a lasting impact. Engage your lower abdominals, that transverse abdominis, breathe. Exhale as you lift your baby up from their crib, up from the floor, up out of the swing. All of those little pieces are going to help establish greater symmetry in the body and really get our body moving with fluidity instead of holding our breath and holding tension against our movement. being mindful of postures when standing or walking, and then of course, safe handling of infant carriers. There is a method to this. We don't have enough time for me to go into it too much. But it is something to really be aware of, and that we're not kind of really loading our body in on that infant carrier. We're not trying to hoist it up with one arm and really kind of offset our body. If I were designing those things, I don't know, maybe I could do better. I don't know, but it's one of those things that, you know, these are some constants and things that we have to do. But if we can be a little bit more mindful of how we're doing them, we can really set ourselves up for greater success. So what could an evaluation with me look like, or even just a discovery visit? And as I mentioned, our discovery visits, we kind of have for patients to come in and have a discussion about things that they're recognizing. So if you're sitting here through this and you have thought to yourself, gosh, Jen's mentioned like a whole bunch of things already that I didn't even realize, that discovery visit might be something for you. It might be something to come and learn a little bit more information about, and specific to you, how I can really help. But what would it really look like? It would be a very comprehensive subjective interview. I'd want to know how long these symptoms have been happening. Do you have pain? What's that report of pain? Your childbirth history, what was that like? Functional limitations. And I'd want to know everything before that. Previous surgeries, previous past medical history, previous injuries, all of those things. Our body is like this little memory capsule that kind of holds on to everything we've been through in our life. So all of that is super important. Postural assessment, looking at a number of the things that I've already mentioned. And then a little bit more specifically physical therapy, if you've been to physical therapy before, looking at examination of movement and function, looking at range of motion, strength, any kind of fascial restrictions, muscle tightness, muscle compensations, nerve issues, right? Is a muscle just not firing? Is there nerve tension? Are you feeling burning, numbness, tingling? I would look at all of that. An abdominal assessment is important to me, looking for scars, whether they be C-section scars or scars related to anything in your history, the muscular strength of the abdominal wall, any form of diastasis, any compensated breathing mechanics. And then, of course, if we felt it necessary, or if your major symptoms were pointing us here, a pelvic floor assessment. And oftentimes, oftentimes, that is composed of external and internal examination. And so that is more of a vaginal, potentially a rectal assessment, depending on what the symptoms are, which could be a whole other video for me to describe, you know, what that entails, and making you as a patient feel comfortable with what that would entail. But the best way that I describe it to my patients is, you know, if I wanted to kind of look at those back muscles, I could palpate your back and I could feel them pretty well. The way that we palpate those for those pelvic floor muscles, and to really be able to examine their strength, length, and tension, all of those things, assessment of pain, is by, you know, a digital insertion, meaning a finger insertion into the vaginal or anal opening, to be able to really target those muscles and piece together all of the symptoms that you might be experiencing to get your body, let's call it new body, right? Get your new body back after baby. And education. Clearly, I like talking. You can hear it throughout this whole presentation, but I also really, really love educating. I love making sure that my patients are understanding top to bottom why we're doing what we're doing, why it's important, why it relates, because that would hopefully, and I see it every day, gives people more confidence that what they're here for is being heard, it's being assessed, it's being communicated about, and there is no silly question, there is no stupid question. All questions lead to great answers and great understanding of how our bodies work. And so, you know, if you're, like I said, all along, that discovery visit is a one-on-one assessment where we do a lot of communicating about what's going on. It is free. It is an opportunity to come in and see our clinic, meet me, discuss some symptoms that you may be having, and really find out if physical therapy is the right tool for you. It might not be, but it might be. And I would be happy to be that person that can assess whether physical therapy is the right tool for you and what you're experiencing. And so below is just a little information as to where you can reach us, how you can get in touch with us. You can look at more information on our website. You can email us any inquiries, any questions, or you can reach us by phone to be able to give you a well-rounded answer to some of your questions and set you up with what you need. And this is just a cute little picture of our team. It's a couple of friendly faces that you would see should you come visit us. And thank you for joining us. I really hope that there was some valuable information. And if there is time and anyone has questions, I'd be happy to answer them.